Welcome. Did you know that stroke is the fifth leading cause of death in the United States? Every minute counts during a stroke, yet many people dismiss the early warning signs. Today we'll uncover 9 silent signs of stroke that every senior should know. Recognizing these subtle symptoms and acting fast can make the difference between a full recovery and permanent disability. Stay with us, and don't forget to share your thoughts in the comments. 1. Sudden numbness or weakness. If you suddenly feel numbness or weakness in your face, arm, or leg, especially on one side, it could be a stroke. This may feel like your arm or face is heavy or tingling. Even if the sensation passes quickly, it could be a transient ischemic attack, TIA, a mini stroke, and a warning of a full stroke. What to do? Ask the person to raise both arms. If one drifts down, call emergency services immediately. Note when the symptoms started. This helps doctors decide on treatment. 2. Confusion, trouble. Speaking or understanding strokes can impair the language centers of your brain. Suddenly slurring speech, speaking gibberish, or having trouble understanding what others say are classic signs. Silent strokes can also cause subtle confusion or disorientation. What to do? Ask the person to repeat a simple phrase, like, "The sky is blue." If they can't, call 911 right away. Don't assume it's fatigue or a senior moment. 3. Vision problems. Sudden blurred vision or blindness in one or both eyes can signal a stroke. Double vision and drowsiness are additional danger signs, and posterior strokes may cause vertigo and double vision. What to do? If your vision suddenly changes or you see double, even for a few minutes, call emergency services. Vision often returns to normal quickly, but the underlying cause could be serious. 4. Trouble. Walking, dizziness, or loss of balance. Strokes can affect your sense of balance. Sudden dizziness, clumsiness, or difficulty walking could indicate a stroke. Silent strokes often leave survivors with long-term issues with balance or coordination. What to do? If you feel unsteady or notice someone stumbling, don't dismiss it as vertigo. Sit or lie down to avoid falling and to call for help. 5. Severe headache with no known cause. A sudden, severe headache, often described as the worst headache of your life, can indicate a hemorrhagic stroke. InformHealth.org notes that sudden, severe headaches may accompany nausea and vomiting. What to do? If you or someone else experiences a thunderclap headache, seek emergency care immediately. Do not drive yourself. Call an ambulance. 6. Unexplained. Fatigue, confusion, or memory problems. Strokes can be silent. According to the American Stroke Association, women in particular may experience general weakness, disorientation, memory problems, or fatigue. The UPMC notes that silent strokes often go unnoticed, but may cause long-term issues with memory, focus, or balance. What to do? If you feel unusually tired or confused, especially combined with other subtle symptoms, talk to your doctor. They may run tests to identify a silent stroke or risk factors. 7. Nausea or vomiting strokes can trigger nausea or vomiting, especially when they involve the brain's balance centers. Posterior circulation strokes may cause vertigo, headache, and vomiting. What to do? If nausea strikes suddenly along with dizziness or headache, call emergency services. Don't assume it's a stomach bug or food poisoning. 8. Vertigo, slurred speech, and difficulty. Finding words, posterior strokes can present with vertigo, imbalance, slurred speech, or trouble. Finding the right words. A silent stroke might cause clumsiness or trouble walking and speaking clearly. What to do? If you suddenly feel like the room is spinning or can't speak clearly, call 911. Tell the dispatcher exactly when the symptoms started. 9. Facial drooping or drooping eyelid. Face muscles may be affected by stroke. You might notice a drooping eyelid or one side of the mouth sagging. What to do? Ask the person to smile. If one side droops, time is critical. Call for emergency help. Note when the drooping started. Conclusion and call to action. These 9 signs may save your life or the life of someone you love. Stroke is an emergency. Call 911 immediately if any of these symptoms appear. Don't drive yourself or hesitate. Remember, the F.A.S.T test, face drooping, arm weakness, speech difficulty, time to call 911. Please share this video to spread awareness, leave a comment with your questions or experiences, and subscribe for more health tips. Together, we can make sure everyone knows these silent signals.